Advisors to the U.S. Centers for Disease Control and Prevention have made contentious decisions recently regarding vaccine recommendations, signaling a divergence from established, long-standing public health practices around the world. These moves, occurring under the direction of Health Secretary Robert F. Kennedy Jr., have prompted alarm among medical and infectious disease experts. Today, the CDC advisory panel voted to restrict the blanket recommendation for Hepatitis B vaccine in newborns. This panel, whose members were appointed by RFK Jr., moved to eliminate the broad guidance that all U.S. newborns receive the Hep B vaccine. The core change in guidance is that for infants born to mothers who test negative for the virus, the decision to administer the initial vaccine dose should now be based on shared clinical decision-making between parents and a healthcare professional. This term, however, is typically reserved for non-routine immunizations and is considered poorly defined in this context. While consulting with a doctor has always been standard, experts worry this new wording will introduce confusion and create barriers to access, particularly for lower-income families who rely on programs like the Vaccines for Children initiative. Medical professionals on the committee, like Dr. Cody Meissner of Dartmouth College, strongly oppose the measure, arguing that changing the wording creates barriers to care and will inevitably lead to an increase in preventable infections among children. He emphasized, "We're giving it to protect the infant against a potentially fatal disease. We know it's safe, we know it's very effective, and to make the changes that are being proposed, we will see more children and adolescents and adults infected with hepatitis B."
I think that what you're seeing is ideology supplanting science, conspiracies supplanting process. And what's happening is that there's been a vote that's conducted that really doesn't change very much. Access remains the same, but creates doubt, confusion, and will result in more children getting hepatitis B. And ultimately then getting chronic hepatitis B, 90% of them will if they're infected, and 25% of them will die early. And so, as one of the ACIP members said, this is harmful, and this committee is going to be responsible for that harm and needs to take that responsibility.
The potential public health impact is significant. Delaying the initial Hep B shot from birth to 2 months could lead to a substantial rise in cases, including an estimated 1,400 new infections, 300 cases of liver cancer, and 480 deaths annually, according to a recent modelling study. Since over half of the infected individuals are unaware of where they contracted the virus, which can survive on surfaces for up to a week, universal vaccination at birth is deemed critical for providing protection before potential exposure occurs. The advisory body also controversially recommended an unstudied practice of giving infants blood tests after the first shot to assess protection levels, a measure outside the scope of its usual authority. The second day of the meeting was reportedly heated, with members arguing the vote was unconscionable due to insufficient data supporting the new approach. The advisory panel's recommendations are non-binding, but heavily influence official policy and insurance coverage. The American Academy of Pediatrics continues to strongly recommend that all infants receive the Hep B vaccine within 24 hours of birth. And in a separate alarming development, the CDC's website has altered its official statement regarding the link between vaccines and autism. The agency's website now suggests that a link between vaccines and autism cannot be ruled out, reversing the CDC's long-held and scientifically proven stance that there is no connection between vaccines and autism. This change contradicts a vast body of high-quality research from independent sources across 7 countries involving millions of people, which has repeatedly and unambiguously debunked the vaccine autism conspiracy theory that RFK Jr., who is not a doctor, subscribes to. The AAP and other public health experts have voiced deep concern, arguing that this change promotes false information and fuels vaccine hesitancy, which has already led to a resurgence of preventable diseases like measles.
For parents, it just means confusion. So I would say that the most important lesson from the ACIP over the last few months is don't listen to the ACIP. I think that you have the American Academy of Pediatrics, the American College of Physicians, the list goes on, who are actually clinicians that practice, that are very clear that this vote was something that will actually result in harm to children. And so what parents should do is talk to your pediatrician. Do not listen to the noise, focus on the signal. And we know that this vaccine has a very favorable risk-benefit ratio. So why are we messing with something that is both safe and extremely important in preventing terrible complications in children? So that's what I would say. Talk to your doctor, talk to your pediatrician. Don't listen to these guys.
A spokesperson for Trump's Department of Health and Human Services stated that the previous claim, vaccines do not cause autism, was not evidence-based because studies have not ruled out the possibility that infant vaccines cause autism. Experts countered that this reflects a fundamental lack of understanding of the term evidence and is akin to using anti-vaccine tropes. Furthermore, current and former career scientists at the CDC reported that these website updates were unvetted and blindsided them, signaling that the agency's vaccine information is no longer considered credible by some within the institution.
You know that moment when you suddenly realize it's December 23rd, the shelves are empty, and you still haven't found a gift for that impossible person on your list? Yeah, well, I've lived that life too, more than once. My panic-buying Christmas Eve sprint is practically a holiday tradition. But this year, I finally found the last-minute lifesaver. Aura frames. For me, the person I can never shop for is my stepdad. He always says he doesn't need anything, which is code for good luck, so he's getting an Aura frame from me this year. And honestly, it's perfect. I've already preloaded it with old family photos, a couple of embarrassing childhood pictures, and even some videos. The cool part is I can keep adding more from anywhere, anytime, and it just shows up on his frame like magic. And setting it up, stupidly easy. You just download the Aura app, connect it to Wi-Fi, and you can upload unlimited photos and videos. Plus, every frame comes in this really clean, premium gift box, so even if you're a procrastinator like me, it still feels like you planned ahead. Because you can't wrap togetherness, but you can frame it. For a limited time, save on the perfect gift by visiting auraframes.com to get 35% off Aura's best-selling Carver matte frames, named #1 by Wirecutter, by using promo code 5MIN at checkout. That's AURA frames.com, promo code 5MIN. This deal is exclusive to listeners and frames sell out fast, so order yours now to get it in time for the holidays. Support the show by mentioning us at checkout. Terms and conditions apply.
These recent moves are part of a broader pattern under Secretary Kennedy that runs counter to mainstream medical and scientific organizations with consensus throughout the globe. Earlier this year, Kennedy replaced the entire membership of the influential Advisory Committee on Immunization Practices with his own appointees. In one of its first actions, the new ACIP also called for the removal of the preservative thimerosal from some flu vaccines, despite safety concerns about having it been extensively debunked. Federal health agencies have also made it more difficult for the public to access COVID-19 vaccines and cancelled grants intended to fund new vaccines that utilize mRNA technology. These actions are viewed by vaccine proponents as recklessly undermining public confidence in immunizations, increasing the risk of childhood diseases, and potentially jeopardizing the United States' status of having eliminated measles. The combined changes signal a profound shift in federal public health policy away from consensus-based scientific guidance and towards political advocacy for long-debunked conspiracy theories that ultimately will result in death. I'm Anthony Davis. You can find me on the 5 Minute News YouTube channel and podcast, on Wednesdays co-hosting Uncovered, and on Sunday on The Weekend Show with Midas Touch.